Thank you very much. As we move forward, I think it is crucial that we are tracking the right metrics so that Americans have a useful understanding of relative risk and better understand the steps that they can take to limit their own risk, just as you say, including these vaccines that work, that are safe, and that save lives. Thank you.
Thank you. Senator Braun.
Thank you, Madam Chair. First question will be for Dr. Fauci. I was watching the interchange between you and Senator Paul. That is always entertaining. And I think what I'm interested in today, because it was back on May 26th, we had a hearing. And what's happened at the Wuhan Institute of Virology, there's a debate out there, and it's not clear what happened. And the thing I remember at the tail end of our conversation, because the merits of the case either way, Senator Paul makes it one way, you make it the other way. EcoHealth comes into play in terms of what happened there. Transparency, and you were on record as saying you like it, you love it, you believe in it. I pressed you that day, on something I'll get to in a moment, but what about releasing all the information that you do have under your control? Because I think as long as the American public can't see it, with all the mystery surrounding what happened in terms of its origin. And I think then you said, you could maybe suggest it to President Biden on declassifying information when it comes to the subject I'm going to get to in a moment. Will you agree, liking transparency, to get all of the information out there as it relates to the origin so we can all see it here in the Senate, across the country?
Thank you for that question, Senator. Have always been, am now, and will always be very, very much for total transparency in everything we do. So as far as I'm concerned, what you're saying resonates very strongly with me. I do want to make one point, because it gets confusing to people. One of the things that's very, very clear, irrefutable, that the NIH funding of grants in Wuhan and the viruses that were discussed, including the viruses that Senator Paul mentioned, would be molecularly impossible to have resulted in SARS-CoV-2. And that sometimes gets conflated when they talk about your funding research there, where people can argue about the definition of gain of function or not. I gave you the process whereby that definition was established. But what gets confused and conflated is that any of the card-carrying molecular virologists will tell you that, notwithstanding the debates about definitions, the funding by the NIH of the grant and the viruses that were worked on could not possibly have turned into SARS-CoV-2, because they are evolutionarily so distant that nothing anybody could have done that. And I really feel I need to say that. But getting back to your question, I'm all for transparency.
I'm talking about, so has all the information, period, been released that pertains to that subject? Because that looks like it would be under your control to do that. So is it out there publicly?
I'm not sure exactly what you mean by all the information, but I can tell you anything that is under my control, that is legally able to be released, I am all for 100% releasing. I promise you that.
Well, we're going to make sure that all of that is out there, because one of the most difficult things about this whole navigation is that there are varying opinions. Not everybody is going to agree with you. We'd like to see it so we can sort through it where other experts look at it and the American public. Now, let's get back to the whole housing that we have within our own departments. Josh Hawley and I had a bill that passed by unanimous consent through the Senate to declassify that information. And again, you said you were for transparency. You were hesitant about that not being your bailiwick. Is that something you would want to go on record with to advise the president to get that declassified so that we can see it, the American public can see it? And that was discussed, and you thought you might be willing to do it back on May 26th. Do you want to publicly say, do it?
So, Senator, to be quite honest with you, I don't really know when you say classified information. What information are you referring to? Because the NIH, the information that we involve with, is not classified at all.
Now, this would be stuff that we hold within our intelligence departments. Senators have been able to look at it. It's not been released. Department of Homeland Security, that's not what you house within the NIH. And that is you being the main advisor to the president on this issue. Why wouldn't you say declassify it so we can look at it?
Well, I would have to find out, Senator. I mean, when you're talking about classified information, that's certainly above anything that I do, because I want to reiterate for the record that the NIH does not do any classified anything. Everything we do
all
is
100
transparent.
senators were for doing it. Many of us had the ability to look at it. You or others, Dr. Walensky, it may be a big deal to do it. Real quickly, thank you for those answers. I got a question about, and this is aimed at Dr. Walensky. What about the importance of therapeutics? And I asked you this back on May 26. Where is that in the whole journey in terms of having another tool and prophylactics as well? Because there's a lot, all of us acknowledge that a vaccine was a miracle to get. You're seeing where you're running into some that simply won't get it. It's hard for me to imagine that you'll vaccine the rest of the world. When do you put the same amount of enthusiasm on the other two tripods of the stand to actually put every tool in the tool chest aimed at getting rid of this or at least treating it?
Thank you, Senator. I'm absolutely for using therapeutics, but I think they should be used after we use vaccination, because vaccination, certainly we have seen that the therapeutics that are out there, the remdesivir, dexamethasone, the molnupiravir is a promising new therapeutic that Dr. Fauci just mentioned a few minutes ago. All of those would be after you're infected. They work to prevent severe disease and death. They're not foolproof. So certainly my first tool in the toolbox would be for vaccination. And then, of course, we would need testing, because most of these therapeutics actually work best after you have, especially the oral one, the molnupiravir, work best if you can give them early. So I do think we need as many tools in this toolbox as possible. I would also say that the best public health intervention here would be vaccines.
And you've said that before, and thanks for
Senator,
reiterating
you
it.
are
I
over your
just
time.
ask you to put that same enthusiasm and speed behind the other things that might be out there to help us. Thank you.
Thank you. I'm going to go vote as the senators know. A vote is open. The next two senators will be Senator Murphy and Senator Murkowski. I hope to be back by the end of that.
Thank you very much, Madam Chair. Thank you to all of you for your service to this country during an incredibly trying time. I thought that Senator Collins' line of questioning deserved a follow-up. She asks a good question. She says we got high vaccination rates in Maine, and so why do we still have so many deaths? But I think it's important to sort of step back and look at the